Nursing home workers have to get the COVID-19 vaccine thanks to a federal mandate that was upheld by the Supreme Court.
You'll remember nursing homes were one of the first places impacted by the pandemic in 2020. As of 2 weeks ago, more than 200,000 residents and staff members of long-term care facilities have died due to COVID-19.
The federal government now has a tool to track vaccination rates among residents and staff at these facilities. But a KSHB 41 I-Team investigation is raising questions about the accuracy of that tool.
Here's I-Team reporter Sarah Plake.
Turn right at the next street.
It's hard to know where to turn when your loved one needs care in a nursing home. Navigating that process in a pandemic, you might feel like you're going in circles. We could all use a compass to find that care. But can you trust it's pointing you in the right direction? Tracy Hawkins made the difficult decision to move her two elderly aunts, Lola and Cordia May, into a Kansas City nursing home in 2020. It was up to her to make sure they received proper care, especially once the COVID-19 virus emerged.
One had lung cancer and the other had Alzheimer's disease. Both of them needed to be protected.
But making sure they were protected was a struggle.
It was a fight every step of the way. From the time both of my aunts were in the nursing home, there was always a fight.
Her aunts passed away before the vaccines came out, something she said could have helped in that fight. And they also died before the Centers for Medicare and Medicaid Services, or CMS, started posting COVID-19 vaccination rates on the Medicare.gov website. For the past 5 months, CMS has made this information readily available. By using the Nursing Home Compare tool, you can search for a nursing home by zip code or city, browse through the homes in your area, and pull up the vaccination rates for staff and residents. There, you can compare the rates to the state average. We track the vaccination rates for staff and residents from a sampling of 160 nursing homes in Missouri and Kansas for 6 weeks, starting in late October. The yellow on our spreadsheet shows nursing homes with rates lower than the state average. The green are facilities who reported that 100% of their staff or residents were fully vaccinated. And the red here, these are facilities who reported nothing. But in the middle of tracking these numbers, our investigation took a turn when we asked CMS who verifies these numbers on their website. CMS told us they rely on the nursing homes to self-report. CMS does not verify this data, and they told us it's generally accurate.
Unacceptable.
Tracy was shocked to hear our findings.
How can anyone with a loved one in a nursing home or a care facility have peace of mind? It's inexcusable. It cannot be allowed, and I don't know why it's okay.
We also shared our findings with Mitzi McFatrich with Kansas Advocates for Better Care, a nonprofit that advocates for long-term care residents.
Vulnerable older adults who basically are captive in a building are at tremendous risk.
Mitzi says she's not surprised the data is generally accurate, referring to a 2015 government report that found CMS wasn't verifying staffing levels. So, is it even possible to verify vaccination data?
Of course it is.
She says look no further than state and federally required background checks.
That's been in place for a number of years. Validating whether or not somebody has a vaccination should be a fairly simple thing.
We want to be clear. No one is suggesting that any nursing home or facility is falsifying the data they report. But Mitzi worries the opportunity is there.
When you have self-reported data that is not audited by the government, either federal or state, or not validated during the survey inspection process, what you do is you leave a giant door open for facilities that want to game the system.
It is so hard right now to know who to trust, if to trust.
Linda Mowbray is with the Kansas Healthcare Association, which represents more than 250 long-term care providers. She says the data reflects the industry's current state of distress.
Not only are we just hemorrhaging for help, we have had staff turnovers in very, very key positions. There is a possibility of a lag time before someone else is up to speed and can get that data entered.
This is compounded with the fact that state surveyors have not completed yearly inspections in 2 years, and it could be months before inspectors can verify vaccination records. But Linda says the data is as accurate as it can be for any given point in time.
I don't know if we'll ever get to the point where we can say any data source is 100% accurate. There's human error there's technical glitches.
Tracy hopes the CMS vaccination data will have added accountability.
It's life-saving information.
Especially when families have to navigate this difficult decision.
If you had a loved one in a care facility or a nursing home, would it be okay if the data is not up to date? Not just any data, but life-saving data. Would that be okay with you?
Sarah's joining us in the studio. Sarah, it sounds like it's up to the families to take action here. If they want to do that, what options do they have?
There are a few things you can do. Number one, visit the nursing home in person. Make sure the staff knows your name and you know theirs. Talk to the people who live there and their families. They'll tell you what's going on. And ask to see inspection reports, staffing reports, and vaccination reports. We have a comprehensive list of resources on our website right now, kshb.com. And CMS's website does not have a disclaimer that says the vaccination data is generally accurate and unverified. But after we started asking questions, CMS added a line to its website suggesting that consumers can ask a nursing home about any recent COVID-19 information, any recent outbreaks, and what percentage of residents and staff have received a booster. CMS declined our request for an on-camera interview. And one final note tonight, we learned the Inspector General's office will release an audit later on this year about the accuracy of staffing levels, health, and quality care measures on CMS's Nursing Home Compare website. And we will keep you posted on those findings. For the I-Team, I'm Sarah Plake.